Good morning, everybody. It is time for the Orthopedic Minute with our friends from DMOS, and joining us in studio right now, Michelle, is Dr. Lee Evans. He is a doctor of podiatric medicine.
Yes.
Okay, how about that?
It's a mouthful. Everything we're talking about this morning is a mouthful, and we're going to leave it up to you.
It's all foot.
So you're a foot doctor.
Yeah, it's all foot.
It's all feet all the time.
All feet all
now,
the time.
we're going to talk about something, hallux limitus. Michelle, you knew what that was right off the bat.
Chronic turf toe, he was talking.
Yeah.
I thought, that sounds like something we don't want, but...
Yeah, easier
Now,
to remember.
Chronic turf toe, let's explain what this is, because this sounds like something that would be, and I'm not joking, a lot of people thought, oh, is that something the kickers in the NFL get? But no, this is something else that happens to regular people, right?
Sure, we see it probably from 18 on up, men and women both.
And what is the definition of this?
Sort of a chronic degenerative joint disease of the big toe joint. There's a lot of force that goes through the big toe.
Of the big toe. Okay, and we have you have a little model here. Want to show what we have?
Yeah, I have a little model of the implant that we actually put in for that's new on the market, and that's why I'm here to talk about that today. Chronically, if you had arthritis in your big toe joint, you'd probably require a fusion at some point. But some people don't want their big toe fused.
Okay.
People that wear high-heeled shoes, if you like to go out and run a lot, that's a difficult
because that
problem.
makes it a solid bone.
It's a solid bone at that point, and so like if you wanted to wear a high-heeled shoe, like an inch shoe or something like that, that would be difficult.
Wow, I never even thought about that.
Yeah, so this is an alternative to.
There's a lot that goes on with our big toe. Talk
a lot
about
of
just
force, a lot of force through the big toe, you know, and it bears probably 25% of the weight to the front of the foot. Yeah.
Didn't realize that. So what causes this? What causes the joint to break down like this?
Some of it's genetic. You know, the shape of your bone is genetic, and some people's shape of their bone leads to arthritis. Sometimes it's activity. It's a shoe gear that we wear, those types of things.
All right, and the best type of shoe gear that you think is important that people, because really quality shoes really make a difference.
I think the real issue is that some people think you need a softer, flimsier, more comforting shoe. I think it's just the opposite. I think you need a stiff-soled shoe. The toe bends less, gives you more support through the arch.
Okay, so just some of the things to keep in mind. And what can we do if we realize that there's something going on with our toe? Now, where's the pain when we're talking about this, the turf toe?
It's going to be centered right in the big toe joint where the big toe moves.
Okay.
And it's usually going to be on top. And
on top?
Yep, and over time you'll start to experience some of these bone spurs. You'll feel fullness there. You'll see swelling there over time. It's almost always on top.
Wow.
Will it hurt to walk and so forth? What are some of those things that people feel?
Achiness with walking-related activities. You'll find that if your foot is in a little bit of a heel, that you're going to be a little more uncomfortable at the end of the day.
You probably have more weight on it then.
Yeah,
right?
and you're going to notice a limited motion over time too. You know, so it's going to get stiff over time.
Right.
Are there things we can do to help kind of prevent this or keep it at bay?
We put people in stiff-soled shoes. We put people in arch supports. We try to stay away from flip-flops and sandals as much as possible. Of course, it's easy this time of year, but yeah.
Let's talk about shoes for a minute, because that does make a big difference. And when we're shoes and high heels and so forth, there may be things that we could look out for to kind of keep our feet in good health.
Sure. You know, you want a good construct to your shoe. You want a nice stiff sole. Like I said, you want a good arch support. You want a good upper. You know, laces are better than slip-ons. It gives you a little more control of the upper part of the foot.
Just to keep the foot stable.
Yes.
That is really good. So now, what do you try to do to alleviate some of the pain? Is there medication that we can take for it?
Sure.
We have the shoes. That's the first thing you want to try first, right?
Yeah. Most people have tried maybe an anti-inflammatory like an ibuprofen or a Motrin or something like that. When they get to our office, which we're usually doing orthotics or cortisone injection in the joint.
Okay, now taking like the oral medications for that can only work for so long, can't it?
Sure, and there's a certain amount of side effects from taking those medications long term, and so you really don't want to take those long term if you don't need to.
Okay, so you change your shoes. You've tried the over-the-counter medicines or even the prescribed medicines. You had your cortisone shots, and still nothing's working, and you're still in agony.
Sure.
What's the other option?
So typically we would do what's called a chylectomy, which is a joint cleanup procedure, much like if you had your knee scoped. You go and you clean it up. But some people's arthritic condition or their cartilage, and I think you have an image to show.
Okay, yeah, and is this the image we want to make sure we warn people? Okay, before we show this, I just want to let you know, if you're a little squeamish, close one eye. But we have to show this. We want to show this so you see what exactly it looked like before and what it looked like after. Now, take a look. Explain the before picture.
So on the left side, if you go and you clean that joint up and the articular cartilage is missing, then you know you're going to have to do something to destroy the joint because the joint's no good anymore.
Oh, really?
So you're either going to have to fuse it. We put those two bones together, put a plate over it, and that keeps it from moving, and that eliminates your pain. But if you want a toe that still moves, you need an alternative. And in this case, we do a partial joint replacement with what's called Cartiva.
Cartiva, and that's what you have here. Let's hold this up so you guys can see this. I'm going to hold this here still so you can take a look at this. I want you to explain how this goes, because it looks like it's going into the bone. You have a like an acrylic big toe here, which what do they call this bone? Is that still a phalange?
Yeah, well, the phalange would be the toe. This is the metatarsal.
Metatarsal, okay. The metatarsal looks like it goes into the metatarsal.
Correct. So we take the area where the cartilage is missing, and we drill that out, and then we put the Cartiva in there, and it's kind of like the candy dots if you ever eat it. Goes to the movie theater. That's kind of what they look like.
So you slide it in, and does it expand when it gets in there?
It's
press fit.
Yeah, so it doesn't move after.
So it keeps it stable. But it still has a little bit of motion on it.
Yeah, and it gives you an artificial smooth surface for the toe to move against, so you're not moving against raw bone.
And what kind of downtime do we have with something like this?
Very little. You can walk on it afterwards, with stitches in for 2 to 3 weeks, and then back into regular shoes.
So this is kind of an outpatient procedure.
It is. It's in and out same day.
And then is this long lasting? Is this kind of one and done?
That's a great question. You know, it's been the European study's been around for about 10 years. It's new to the United States, probably within the last 3 or 4 years.
Okay.
So far, we've had real good luck with it.
That is great. Yeah. Awesome. Now, people want to, maybe some people are experiencing this pain. You didn't know what that pain was, and you need to do something about it. What's the easiest way to get a hold of you guys?
Just call us directly at DMOS at 224-1414.
Okay, and what office are you located at?
I'm at the West Des Moines office.
Wonderful. Yeah. Great stuff. Again, trying to eliminate...
take care of our feet.
Hallux limitus.
Yes.
Okay, or chronic turf toe. It does happen. Arthritis in your foot. Is that the most common form of arthritis in the foot?
Probably in the forward part of the foot, yes.
In the forward part of the foot.
Yeah.
All right, wonderful. You guys are awesome, and we learned something today. That
always.
is really cool.
We always learn something when you guys come in.
Yeah, very cool.
Very important.
Dr. Lee, thank you so much for being here.
Thanks for having me. I appreciate it.
Appreciate it.